Alright, so I'm going to be talking about hippotherapy, which is the use of horseback riding as a therapeutical treatment, especially as means of improving coordination, balance, and strength. It is an emerging intervention being used in PT to treat and manage conditions dealing with sensory, neuromotor, and cognitive systems to promote functional outcomes. So, why hippotherapy? And the purpose of this report for me fall in the same category. I think is very cool that it can easily be a session that combines physical, occupational, and speech therapy all together in one session. It's also a fun way to do therapy with kids, and it allows interaction with animals, which can go together with this topic here about having higher compliance and satisfaction levels. It also has calming effects on and emotional benefits to the kids, and faster and better results than conventional physical therapy by itself. For learning objectives, the audience will be able to list at least 3 neurological conditions that highly benefit from hippotherapy. And also, the audience will be able to describe what hippotherapy is and aspects of one's health that can be improved with this intervention. So, what it's all about? The APTA the APTA refers how occupational therapy, physical therapy, and speech-language pathology professionals use evidence-based practice and clinical reasoning in the purposeful manipulation of equine movement as a therapy tool to engage neuromotor, sensory, and cognitive systems to promote functional outcomes. So the main diagnosis that hippotherapy is used with is cerebral palsy, Down syndrome, multiple sclerosis, arthritis, autism, head injury, stroke, spinal cord injuries, and psychological disorders. Hippotherapy uses the natural gait of the horse to treat symptoms of many organ systems. The rhythmic movement challenges all the aspects of trunk control, and it really helps balance and posture. The movement of the horse mimics the movement of our own pelvis during our normal gait. So gait is one of the things that can be worked on in hippotherapy, even though the person is not weight bearing, because it is mimicking that pelvic movement. It also improves coordination, strength, and range of motion. These are some fun facts. The average horse walks at a rate of approximately 100 steps per minute, meaning just 5 minutes of walking on a horse represents 500 neuromotor inputs to the patient, meaning 15 to 25 minutes of hippotherapy is equal to 1,500 to 2,500 neuromotor inputs to the patient, which is an amazing amount. The horse influences the client rather the client influencing the horse. There are infinite ways that you can do therapy on a horse with the kids. They may be positioned facing forward, backward, supine, prone, standing, side lying. You can use many creative things to make it fun and functional for the kids. It is the therapist's responsibility to analyze the patient's movement and responses and adjust accordingly, as well as be able to modify the cadence and direction of the horse as designated by the client response. So a few takeaway points that are very important for me after reading and talking about this with you is that compliance and participation with this type of intervention is very high compared to traditional physical therapy for children especially. Also, the horse's movement engages sensory, neuromotor, and cognitive systems. It is an easy way to combine OT, PT, and speech all at once. There are big improvements in balance and posture, and great results for children with many neurological conditions and behavioral and psychological disorders. These are my references and questions.